Welcome to Baby Mama's Wellness Podcast, the home to holistic care and support for babies and mamas. Welcome to Baby Mama's Doula. My name is Racheal Onah, and I'm the founder of Baby Mama's Doula. Baby Mama's Doula is a holistic company focused on supporting the health of babies, mothers, and mothers-to-be. I have an undergraduate degree in biology from York University, and I have a Doctor of Naturopathy degree from the Canadian College of Naturopathic Medicine. I've completed additional certification as a birth doula from the Naturopathic Doula Group. Currently, I work at the Natural Care Clinic in Burlington with Dr. Carissa and Sonia Doherty, where we see a variety of patients, young and old, acute and chronic. So in today's episode, I'm going to be discussing my journey and experience and how naturopathic medicine works so synergistically with pregnancy, postpartum, and pediatrics. And most importantly, why Baby Mama's Doula is so important. So to get started, what is a birth doula? Birth doulas are trained professionals who provide emotional, physical, and informational support for birthing people before, during, and after labor. Birth doulas are not regulated, so it can, anybody can become a birth doula, but getting proper certification allows you to properly support and equip women that are going through labor and delivery, and as well as in their postpartum journey. Furthermore, naturopathic doctors in Ontario cannot be the first healthcare professionals during pregnancy and delivery. So then what's the role of naturopathic doulas? Naturopathic doulas simply are support systems for the birthing person and partner throughout their journey and can provide natural remedies and support to help their birthing process. So what does that look like? First of all, starting with a discovery call. So I've done lots of discovery calls with new moms or moms-to-be, and they're just, it's a way for you to kind of understand who they are, kind of get their expectations, learn where their birthing locations are, when is their partner due? Do they have a midwife or OBGYN? What are their expectations for the birth? Will their pregnancy be complicated? These are things you would really want to know as a birth doula. When I first started as a birth doula, I was a backup for a group of NDs, which gave me the opportunity to ease myself into this role. I learned a lot from being a backup doula, and I would definitely recommend being a backup doula for those that have never been pregnant before or have never been to a birth before. I've learned a lot being a backup, and I've learned some of the issues and the fear surrounding labor and delivery and what to do and how to navigate those things. So being a birth doula is really about hands-on experience. Yes, I learned a lot doing the course and getting certified as a birth doula, but I do think having hands-on experience is important. So before labor, you want to see your birth doula either in person or virtually. I was able to shadow and see MDs deliver prenatal courses, and I loved it. It was almost like an aha moment. Like, this is what I'm supposed to do. This is, my jam. This is what I'm meant to be doing. I love education. I love explaining. I love doing presentations. And it's the only time you can really stand out in the crowd and really showcase what you know about labor and delivery. After my first shadowing, the ND allowed me to do it on my own some of the times. And, I was able to also in person do massage techniques to help you relax during labor and delivery, exercise techniques. I was able to see how impactful those things are when you're actually doing, during labor and delivery. So what happens when the person goes into labor and delivery? So I always tell my clients, let me know once passive labor has started, and then so that I can give you some tips, and then also let me know when active labor has started. And active labor is when you're 5 centimeters dilated. So, and that's also a really great time to inform your healthcare team, your OBGYN, your midwives, anybody else that is meant to be around for the labor and delivery. Let them know that you're now in active labor. If there's any complications before then, do let your team know don't just wait till active labor. Let them know if there's any complications. But usually during passive labor, you want to use that time for like resting, relaxing, getting your energy up, eating. But when active labor starts, that's when you definitely want to make sure that your team is on the go. The important role of being a doula is, you're not alone. We're here to support you. I have driven to patients' homes during passive and active labor just to provide some support, provide some, massage techniques, help them with their contractions, help them with breathing techniques. And so you definitely want to have a doula around, or having a doula teach your partner on what to do if it's just going to be them two there. What I learned from my first time pregnancy can last forever. You will never forget your experience going to labor and deliveries. It does take time to get into active labor. It can take, especially for your first pregnancy, it can take days. It can take hours. Like, it's not like in the movies when the water breaks and it's so emotional, and it's really, really not like that. It's gradual pain, and the intensity increases and the contractions increase, and it's not like the movies. So do not be fooled. Take your pre-labor classes so that you know what happens during that time period. But yeah, any discomfort and pain, you have people around to help you, and I think that's really important. Hospital births are quite different from home births. It has been interesting going to hospitals to kind of see what goes on during that time. And I would say, like, my first time going to a birth was like shocked. Honestly, what I learned in my naturopathic medical schooling and what I learned in my course was completely different from actually going to a birth. I just want to, fully disclose, I have never been pregnant. I have never had a baby. I had never gone to a birth before then, but I have gone to a few now. And it is important to ask if your doula has gone to a birth or has shadowed a birth before, because, it is really important. And I felt like my first time, the midwife there was amazing. I would say that was the standoff thing that I learned, was like the midwife. She was almost like the doula at that point, because I really didn't know what to expect. And so I would say, like, it is good to ask, like, how many births have you gone to? What's your experience being at a birth? Have you ever experienced any complicated births before, or C-sections? Seen an epidural, stuff like that. But doulas have to learn. So if they're not well versed, give them an opportunity. They can be amazing. And the great part of my earlier days of being a doula was that them giving you a chance, and you improve with each birth. And so we have to start from somewhere. And I think the earlier you contact a doula and the more comfortable you are with the doula, and the doula is comfortable with you, the better your birthing experience will be. I would say people have a better success rate when they have known their doula for a longer period of time than like in the last month of their pregnancy. Seeing a baby being born was definitely a big shock. Your eyes will never undo that experience. And it's amazing to see what the female anatomy can really do. Seeing a whole life being born out the birth canal is, it's different. It hits different. And so, you see so much pain and anxiety going through that first pregnancy. And then as soon as the baby's born, it's like they forget the pain that they went through. It's automatically eliminated. So it's a really amazing thing to see. Women are incredible. So, some people ask if people change their mind to have a birth doula around labor and delivery. The answer is yes. I have had several patients that wanted the education or that they just wanted on-call tech support, and will call you if needed. So it's definitely optional and it's flexible. And we're here to support whatever your needs are. It's not like what the doula wants. We're here to help you. We don't make any medical decisions for you. We're here to just give you informed consent. Okay, if you decide to do a C-section, what is the benefits? What's the risk? What's the pro? Do you need me to be there? Do you need, a homeopathic to help you with your anxiety? Those are the kind of things that happen as a naturopathic birth doula. My funniest interaction at a birth was a medical doctor came in and was asking me to do a procedure with the ultrasound machine. And I was like, I went to naturopathic medical school. I'm not a conventional medical doctor. And so I think the fact that I was wearing scrubs made me look very professional. But I was like, sir, like I can't. But it is like nice to see like how open and welcoming some of the doctors and midwives are. As a birth doula, I have had people ask, is it true? Do people poop on the table during labor? The answer is also yes. I have seen it in HD, live. I've seen it happen. It happens when you're pushing down there, the muscles are relaxing, and in the genital urinary area to accommodate the baby descending, different hormones relax, the anal sphincter, which means that when you push, you can poop. So, as healthcare professionals, we are trained to deal with those occurrences. Nurses are on hand very quickly to help clean you up during that time. And so you shouldn't worry, and you shouldn't be embarrassed. We are trained for those kind of situations to happen. I would say the scariest experience I've had, which solidified my experience as to why I became a doula, it was one of my earlier doula experiences. And the midwife that started her shift was amazing. She was incredible. And she was helping her and giving her options and informing her and letting her know. And then near the end, they had to switch. So she had a different midwife, and it's very common. It's common with doulas. You switch and ensure that, you're refreshed, you have energy in order to do it. So the first midwife was incredible. The second midwife that changed over, she, 2 minutes in, felt around, was, looking at where she's at in her labor, and then was like, oh, I think we need to get an OBGYN. I think we need a VBAC or like a C-section. I can't remember. And within 10 minutes, we had like 10 people in the room. OBGYN. It was chaotic. I was so scared because I had never experienced that before. And, I could see that my patient was scared as well. And I had to kind of reassure her, like, you're going to be okay. Everything's going to be fine. Or an induction. It was an induction at the time. And basically, they wanted to, use forceps to remove the baby. And it was very chaotic from what I remembered. And she didn't explain to my patient what a forceps is. So then I had to explain to my patient that this is what a forceps is. This is the complications that can happen with a forceps. Yes, the baby is turned in an awkward way. So when you're pushing, it's not allowing the baby to fully descend into the birth canal. But luckily, the OBGYN that came in was amazing. She turned the baby and she was able to have a natural delivery. But that experience really showed me why you need a birth doula or somebody to advocate for you during your labor and delivery. If you don't know what a forceps is, you're scared, you're going to just say yes. And then when it's all said and done, you're going to be very upset because you didn't know what it meant. So it's very important to make sure that you have somebody there to advocate for you during your labor and delivery. Having a doula does not mitigate the fact that complications may arise. And I do want to let people know that. It doesn't mean that you'll have a natural birth or it will go straight to plan. C-sections may happen, using forceps may happen, using epidurals may happen. I have seen it happen, done on women that I've attended their births. But making sure that you're fully informed and that you know what's going on is important. I've gone to a birth where it was 36 hours in. She waited for me to come to her birth. I was 2 hours away and I was doing a backup for a different doula. And by the time I got there, it was 36 hours in. She was 10 centimeters dilated, 100% effaced, and the baby just wasn't being born. So she asked me, should I, have a C-section? And I was explaining to her the benefits and the risks. And she ended up agreeing to having a C-section. And, the baby and the mother were doing well now. And so you really have to weigh out the pros and cons. But I think the main thing of having a doula is the informed consent. Other things naturopathic doulas may bring to the table is homeopathics for labor, providing acupuncture, acupressure, helping with some massage or breathing techniques. They may also provide, visualization techniques to help you feel more relaxed. In my course, I do explain, why it's important to be relaxed during labor and delivery. And so, the Baby Mama's Doula holistic program, and as well as the Baby Mamas community, is there to help support and educate you so that you are having close to what you would like to have in your birth experience. As a birth doula, I have seen some interesting things, interesting procedures being done. I've seen a Doppler being used, ultrasound, a catheter being put in place, an epidural being administered, water baths. So I've really seen a lot working as a birth doula. And that's why I feel so confident and comfortable educating women on having a safe labor and delivery. Postpartum doulas also have a very important role because now you're supporting the well-being of not only the mother, but also the baby. So following up on delivery and ensuring that no complications have arose, seeing how the baby's doing, the mom's doing physically and emotionally. Naturopathic doulas may also provide additional support for the babies and the mamas, a natural toolkit depending on what support is needed. Being a birth and postpartum doula is so rewarding for everyone involved. And I really do hope this episode encouraged you to get a doula for your birthing and postpartum experience. Thank you for listening to my experience as a birth doula. If you have any questions or would like to have more information on being a client for Baby Mama's Doula, please contact babymamasdoula@gmail.com.
Thank you for tuning into Baby Mama's Wellness Podcast. I'm so excited for you to be a part of the Baby Mamas community. If you like this podcast, hit subscribe to hear more. You can also follow our Instagram page at Baby Mama's Doula or visit our website at babymamasdoula.com.